Hi, this is Dr. Sandeep Mahapatra from Neofollicle Hair Transplant Clinic, Bangalore. Today I am going to discuss a very pertinent issue that is known as why FUE or FUT, sometimes hair transplants, fail to give proper natural results when we do the hairline or the entire hair transplants, and what can go wrong. So we are doing a lot of repair hair transplant cases nowadays. Every week I do 2-3 repair cases of already previously done FUT, FUE cases. So you must understand what we should avoid while we perform a FUE procedure, and what are the pros and cons, and what all necessities we need to do, and how NFT what we do is different from regular FUE, how it is an advanced FUE. So the first case which I want to discuss for a client who had done a FUE procedure a year back from some other clinic, where if you see his hairline, where the hairline is not proper, the density is compromised, all the hairs are growing at 80 to 90 degrees, and even a lot of gaps, and both the sides are not symmetrical, and some hairs have a plugged out appearance which looks very unnatural. So we corrected the case, we did another repair hair transplant, and I'll tell you later how we are going to do it. If you see his donor area, that was also severely scarred with lot of scarring of the FUE donor. Probably the team did scavenging of the donor area by using more than 1 mm punch diameter tools to extract the hairs, and also they tried to remove each and every follicular units, leading to this kind of bad scarring. So when he came to us, this donor was not much there because already it has been scavenged, and even with unnatural hairline. Still, we tried to extract from his other areas with very thin size punch diameter tools, and then we extracted from his beard and chest to give him proper density. The second case which I like to discuss here is a case where if you see his hairline is very ill defined, it's in a straight line. We should never implant the hairs in a straight line. And he did a FUE procedure another 2 years back, where it looks very straight. The hairline is not irregularly irregular. Even there are a lot of gaps to this hairline, even the frontal forelock, a lot of gaps are there, and looks very unnatural and feels like you've done a hair transplant. And the density is also compromised. And there are a lot of plugged out appearance, and we call it a paddy feed implantation, where we implant in a row. We should not do that. If you see his a closer look, and even only this much area was implanted, a big area was left over with lot of scarring of the donor area. So we needed to address this condition. He was very skeptical because it's already done, and lot of again scavenging of the donor area had happened. But we could manage to do 3,500 to 4,000 graft extraction from this patient, and right from his crown area to the entire hairline we corrected with the proper hair transplant. How we did that, I'll just show you. So this is 2 weeks post hair transplant growth. So we enhanced his hairline, a little bit correction. We gave a proper angle to the implanted hairs. In NFT technique of neofollicle hair transplant, which I follow, we use some European implanters to give preferably a 15 to 20 degree angle for the hairline, and we make it irregularly irregular. And then we make it more dense to implant the thicker grafts, like 2 hair, 3 hair grafts beyond the hairline, so that the density doesn't get compromised. And we do it in a crisscross pattern, or in a haphazard way, a random distribution of grafts, so that it doesn't look like a hairline, like a paddy field distribution. And then we try to correct his frontal looks, making it more irregularly irregular, and even we repaired his crown area with lot of grafts, and even the scalps have started falling and hairs have started growing, and hopefully he will get good results. So it's very important to understand not to damage the donor area, not to cause this kind of FUE scarring by using your sponges, or because of inexperience, or not using proper tools or proper methodology to extract the hairs. The donor area is always limited. We should respect the donor area, be it scalp or beard. So in our method of NFT, the donor area scavenging is hardly there. There's hardly any scar. This is 2 weeks post our method of extraction of more than 4,500 grafts we have done for this 50-year-old, 45-year-old individual, compared to another case where they had done a FUE of only 2,000 grafts extraction. So donor area doesn't get damaged in our method, And then secondly, we need to correct the hairline. This is another case where the client was not happy with the overall hairline. We probably did 7-8 months back, and if you see, there is a lot of density loss here. The temples was also not defined, so we had to correct the entire case. Even crown area they didn't address, so we corrected the crown area and the frontal hairline with approximately 3,400-500 grafts. And if you see, they didn't merge with his existing hairs. Merging means you have to implant along with her existing hairs in the same angle. So when we use the European implanters, what essentially we do is we take care of the existing hair angle. Same angle we are going to give for the newly extracted grafts. And so 4Ds are very important when we take care of the implantation part. I always say, first of all, the density. What number of grafts you have got, or the number of follicles. Suppose 3,500 or 4,000 grafts you have got. That means you have got 7,000 to 8,000 above roots of follicles. What density you are going to give? Anything above 40 to 50 grafts per centimeter square is a good enough density, preferably giving a good hairline. Secondly, after a D of the density, we go to the distribution. Where to distribute the single hair grafts, the double hair grafts, how to mix and match this double and triple hair grafts, and how to build a hairline with the single follicular units is very important. Thirdly, after the density and distribution, the depth of the implanted hairs. So in our implanted technology, we have a depth control, so we exactly know the length of the follicles, similar depth we are going to place the graft. We are not burying the grafts, not causing any kind of follicular cyst, neither we are superficial. So the graft always grows properly. And fourth and final, the most important is the direction, the angle of the hair which you are going to give. That will determine the naturality of the results. So the direction should be exactly in alignment with his existing hairs. If he doesn't have those hairs, you ask a previous photograph of his 6, 8, 10 years back photograph and try to give that kind of angle to the hairs. So crisscross distribution of graft, giving a proper optimum density, not pushing in the grafts inside the skin, not burying them, or neither implanting it superficially, and angling the hair is the most important thing which we learn in implantation when you do the implantation. So our method of new follicle NFT is, and that's why quite advanced FUE, and doesn't leave behind this kind of complications of neither donor area scarring like this, or neither the unnatural hairlines. So whenever you choose a clinic, always be assured, talk to your doctor that he should be experienced one, a dermatologist, a plastic surgeon. What is the team experience, how the assistants are trained, what is the experience of the entire team, and what are the reviews of the patient, how many repair cases you have done. So repair cases are not on the rise because a lot of patients are now doing hair transplants, and some are really shabby, which we think after examining that this should not be done like that. Hair transplant is an aesthetic and a serious thing, a serious procedural surgery, and it has to be done meticulously, properly, without giving any kind of complications like any cosmetic procedure. So be careful while you choose a doctor or a clinic. Talk about these important points, salient points. Just don't talk about the graphs and the price, but talk to the doctor and the team regarding the naturality of the results, the scarring, the pain, the complications. I always think it's not about the surgery. Surgery anyone can do. How, if you have got, you should not get any kind of side effects or complications for long term, which might not look good, because at the end, hair transplant is a facial aesthetic surgery. The hairline is a part of your face. How you distribute, where to conduct the hairline. One next video, I will talk more about the hairline designs for different kind of heads, like a triangular head or an oblong head or a big flat head. So that all we will discuss. Today, primarily my focus was to tell you about the implantation mistakes which are done sometimes in FUT, FUE, can cause a lot of aesthetic issues for a client. So be careful and always talk to your doctor regarding this. Thank you so much for patient listening.